If you're over 60 and every step sends a sharp, burning shock down your leg, this video from Health 60 Plus could change your next 10 years. Because many seniors are unknowingly doing good exercises that quietly make their sciatica worse, while 3 simple movements done in under 10 minutes a day can often calm the nerve instead of irritating it. Did you know that a large percentage of people over 60 with sciatica are following routines that actually increase their pain? Recent research on older adults with sciatic pain suggests that many common stretches and exercise classes put extra pressure on the very nerve that's already angry. In other words, the traditional moves you've been shown for decades might be one of the reasons your sciatica keeps coming back. But here's the hopeful part. Some spine and rehab specialists have found that a small set of 3 specific gentle movements often does more than a long list of random stretches. Not complicated yoga poses, no gym, just 3 simple focused movements that most people can do at home in less than 10 minutes a day. One experienced spine surgeon even calls these movements the holy trinity of sciatica relief, because so many of his older patients reported they could walk, sit, and sleep more comfortably after practicing them for a couple of weeks. Many felt confident enough to postpone surgery and continue with conservative care instead. So in today's video on Health 60 Plus, you're going to learn exactly what these 3 movements are and why they can work when everything else seems to fail. The first movement we'll cover is so powerful that in clinical practice, it often brings noticeable relief within the first week for many patients. You can do it lying in your own bed, and it's specifically designed to gently reduce pressure on your sciatic nerve rather than aggravate it. Before we dive in, let us know in the comments your age, where you're watching from. We read and reply to as many comments as we can here on Health 60 Plus, so don't be shy, say hello below. Now without any further delay, let's get started. What sciatica really is, and why it hurts so much. Before we reveal the 3 movements, it's important to understand what sciatica actually is because many people have been given a very fuzzy explanation. Sciatica itself isn't a disease or a single condition. It's a symptom, a sign that something is pressing on or irritating your sciatic nerve. Your sciatic nerve is the longest and thickest nerve in your body, running from your lower back, through your buttocks, down the back of your leg, and all the way toward your feet. When this nerve is compressed or irritated, you get that unforgettable electric, burning, or shooting pain. For many people, the pain starts in the lower back, travels through the buttock, and shoots down into the back of the thigh, calf, or foot. Sometimes it feels like lightning bolts down your leg. Other times, it's a deep, constant burn that won't switch off. You might also feel numbness or tingling like your leg has fallen asleep, but never fully wakes up. A sensation like hot water running down your leg. Weakness, so your leg feels shaky or like jelly when you try to stand up or climb stairs. In people over 60, the most common reasons for this nerve irritation include herniated disc, the soft cushion between 2 vertebrae bulges and presses on the nerve; spinal stenosis, age-related narrowing of the spaces in your spine, squeezing the nerve; piriformis syndrome, a small deep muscle in the buttock spasms or tightens and irritates the sciatic nerve; bone spurs from arthritis, little bony overgrowths that can poke or crowd the nerve. What makes sciatica especially frustrating for older adults is that it often gets worse with normal daily activities, walking for more than a few minutes, standing in one spot, or sitting too long in the same chair. That's why the movements we're about to show you are gentle, targeted, and senior-friendly, designed to work with your body, not against it. Now let's move on to the 3rd movement, the one that starts your healing journey. Movement 103, the modified cat-cow nerve glide. This movement is inspired by the traditional cat-cow from yoga, but we tweak it to specifically target the sciatic nerve pathway. Instead of a general back stretch, you'll be creating what therapists call neural mobilization, a gentle gliding of the nerve. Some research on older adults has shown that carefully performed nerve gliding movements can significantly reduce morning sciatica pain and improve mobility, especially when done consistently and correctly. Therapists have also observed that these types of movements can increase blood flow to irritated nerves and help them heal. How to do it? Starting position: get onto your hands and knees on a comfortable surface, like a yoga mat or carpet. Hands directly under your shoulders, knees under your hips, arms straight but not locked at the elbows. Keep your neck in a neutral, relaxed position. Step 1. Cat with a small knee pull. Shriwet: slowly arch your back upward, like an angry cat. At the same time, look down toward your belly button. Gently slide your right knee slightly toward your chest. Just an inch or two, not a big movement. Hold this position for 3 seconds while breathing normally. Step 2. Cow with a gentle leg extension. Now reverse the movement. Drop your belly slightly toward the floor. Lift your head and look gently forward, not cranking your neck. Extend your right leg straight back behind you, keeping it roughly parallel to the floor. Don't lift the leg high, just reach it back in a straight line. Hold for 3 seconds. Rhythm and repetitions. Move slowly and smoothly, taking about 5 seconds per full cycle. Do 8 repetitions with the right leg. Then repeat 8 repetitions with the left leg. Think of this as a gentle pumping action along the sciatic nerve path. This soft, controlled motion can help loosen up small adhesions and stiff tissue around the nerve, improving its ability to glide instead of being trapped and irritated. Tips for safety and comfort. Do this first thing in the morning, when your spine is more hydrated from lying down all night. Avoid doing it on a full stomach. Breathe steadily. Don't hold your breath. Inhale as you arch up, exhale as you extend back. You should feel a gentle stretch or mild discomfort, but not sharp or shooting pain. If you do, reduce your range of motion or stop. Can't kneel on the floor? You can modify this by standing and placing your hands on a kitchen counter, gently rounding and arching your back and adding small leg movements behind you. It's a bit less intense, but still helpful for many people. Movement 2. The posterior pelvic bridge hold. This movement looks simple, but it's a powerful tool for sciatica because it strengthens the deep core and back muscles that support your spine and protect your sciatic nerve. 2 key muscle groups here are transverse abdominis, your deep corset muscle around the belly, multifidus, small stabilizing muscles that support each segment of your spine. When these muscles weaken with age, which is very common, your spine can become less stable, putting extra pressure on nerves and discs. Strengthening them gently can reduce that pressure. Some long-term rehab programs have found that older adults who regularly perform controlled bridge holds with proper breathing experience meaningful reductions in pain and improve stability. How to do it? Starting position: lie on your back with knees bent at about 90 degrees, feet flat on the floor, hip width apart, arms resting at your sides, palms facing down. Engage your deep core. Before lifting, imagine gently pulling your belly button toward your spine. This is not a big suck in, it's a subtle tightening deep inside, like zipping up a snug pair of pants. Lift into a bridge. Press through your heels and slowly lift your hips off the floor. Aim to form a straight line from your knees to your shoulders. Keep your ribs down slightly so you're not overarching your lower back. Add the special breathing pattern. Now comes the part that makes this different from a basic bridge. Inhale through your nose for a count of 4. Gently hold your breath for 4 counts. Exhale slowly through pursed lips for a count of 8. As you exhale, imagine narrowing your waist and gently wrapping your core around your spine without moving your hips. Hold in repetitions. Stay in the bridge position for 3 full breathing cycles, about 40 to 50 seconds total. Then slowly lower your hips back down over 5 seconds. Rest for 30 seconds and repeat up to 4 more times, depending on your strength. This movement improves spinal stability, helps maintain healthier spacing between your vertebrae, and can reduce pressure on the lower lumbar discs where sciatica most often starts, L4, L5, and L5S1. Safety and progression. For your first few sessions, start with 1 or 2 breathing cycles per bridge and build up gradually. Focus on quality. If your hips start to sag or your back overarches, lower down, rest, and try again. Some people like to place a small rolled towel about thumb thickness under their lower back at the belt line while lying flat. This can help them feel what a neutral spine is before lifting. The best time for this movement is often late afternoon or early evening, when your spine has been compressed from daily activity and needs decompression and support, not first thing in the morning. Movement No. 1. The sciatic nerve decompression technique. This is the movement many people say changes everything for their sciatica. It combines gentle spinal extension with precise positioning of the pelvis and a soft nerve stretch for the leg. The idea is to gently reduce disc bulging, improve fluid circulation in the spinal canal, and restore normal mobility of the sciatic nerve. Again, results will vary, but many people report impressive relief over a week or two when they practice this consistently and correctly. How to do it? Ranar. Set up your pillow. Ranar, keep your stomach on a firm surface, carpet or yoga mat. Place a firm pillow or folded blanket under your pelvis, between your belly button and your pubic bone. The pillow should be thick enough, around 3-4 inches, to create a gentle, comfortable arch in your lower back, not a deep bend. Relax starting position. Rest your forehead on your folded hands or on a small pillow to keep your neck neutral. Let your legs relax completely with your toes pointing slightly outward. Stay here for about 90 seconds, focusing on relaxing your lower back, buttocks and thighs. Many people are surprised how tense these muscles are. Prop up into a gentle cobra. Without moving the pillow, slowly prop yourself up onto your elbows. Elbows directly under your shoulders, forearms flat on the ground. This creates a mild extension in your lower back, while the pillow maintains the pelvic tilt. Hold this position for about 60 seconds, breathing normally. Add the leg bend for sciatic nerve stretch, while staying in the elbow-supported cobra position and keeping your pelvis on the pillow. Slowly bend the knee of your more painful leg, drawing your heel toward your buttock. Move only as far as feels comfortable, even a small bend is fine at first. Hold for about 30 seconds, breathing calmly. Slowly lower that leg back down. Repeat the same movement with the other leg, even if it isn't painful, to keep both sides balanced. The entire sequence from lying flat to finishing both leg bends takes around 4 minutes. Many people like to do this twice a day, once in the morning to gently reset the spine after a night of sleep, once in the evening to counteract the compression and stiffness from daily activities. As days go by, some people notice that their pain centralizes, it moves from the leg back toward the lower back. This can actually be a positive sign that the nerve is decompressing. Over time, the intensity of the pain often reduces from the center outward. Important safety notes. Rofslaudis is a disi of duliuranom. Rofslaudis is a time to gar spikindis. If lying on your stomach is very uncomfortable or you've been told by your doctor to avoid extension, do not do this movement without medical guidance. You can start by holding each stage for half the time and gradually build up over a week. How to combine all 3 movements. These 3 movements are powerful because they each target a different part of the problem. Rofslaudis is a time to gar spikindis. The posterior pelvic bridge hold strengthens the deep stabilizing muscles that protect your spine. The sciatic nerve decompression technique gently encourages disc material to move away from the nerve and helps reset irritated pain pathways. A smart way to start is a week and stress spine. Ruffenstressis wovis friendbor. Week 1 do movement time to gar sterndoktabik volsmixbibor. Tuas dued start mutsastis. To gentula for induation temeritich bibats for wing, though tulid bethoidium, wolpa chula brofod, 3 can tulid strengthen, 3 can dondavlis movement. Fools mufoto dismuflagers. Week 3 and beyond. Do all 3 movements daily, adjusting the time and repetitions to your comfort and strength. Remember, for seniors, healing sciatica is usually not about doing more and more complicated exercises. It's about precise, gentle, consistent movements that support your body's natural healing. Before you go, talk to us in the comments. Now we want to hear from you. What's one thing you were told about sciatica that turned out to be wrong or confusing? On a scale from 1 to 10, how bad is your sciatica pain right now? Which of these 3 movements are you most excited to try first? Share your answers in the comments below. We love hearing your stories and questions here at Health 60 Plus, and your experience can encourage another senior who's struggling right now. If you found this helpful, please and subscribe to Health 60 Plus. We post practical, gentle health tips for life after 60 every week.